How successful is radioactive iodine therapy, RAI, for thyroid? Radioactive iodine therapy is a well-established treatment used mainly for certain thyroid conditions. It works by delivering a small dose of radioactive iodine that the thyroid gland absorbs, destroying overactive or remaining thyroid tissue. Its success varies depending on the specific condition being treated and individual factors. For hyperthyroidism caused by overactive thyroid tissue, such as Graves' disease or toxic nodules, RAI is highly effective. About 80 to 90% of patients experience a complete cure after just one dose. However, some may need additional treatments if the first dose doesn't fully control the condition. After therapy, many patients develop hypothyroidism, which means their thyroid stops producing enough hormones. This is often an expected outcome and requires lifelong thyroid hormone replacement therapy. Regular follow-up is essential to monitor thyroid function and adjust medication as needed. Cases of differentiated thyroid cancers like papillary or follicular thyroid cancer, RAI is often used after surgical removal of the thyroid gland. It helps destroy any remaining cancer cells and treat metastases that may have spread. Studies show that RAI improves long-term survival, especially in patients with intermediate or high-risk disease. For example, in intermediate-risk patients, RAI has been linked to a 29% reduction in the risk of death overall. In high-risk cases, survival improvements of up to 30.9% have been observed. However, for low to intermediate-risk patients, the benefits are less clear, and some studies have shown mixed results. It is important to note that RAI is not effective for all types of thyroid cancer. It does not work well for anaplastic or medullary thyroid cancers, which do not absorb iodine. While RAI is generally safe, it does carry some risks. There is a small chance of developing hypothyroidism, which is often an intended effect in hyperthyroidism treatment. There is also a very slight increased risk of secondary cancers, especially with higher doses over time. Because of these factors, treatment plans should always be personalized and discussed thoroughly with healthcare providers. In summary, radioactive iodine therapy is a key treatment for many thyroid disorders, with proven success in curing hyperthyroidism and improving survival in certain thyroid cancers. Its effectiveness depends on the disease type, risk level, and individual health factors. Always consult with a healthcare professional to determine the best approach for each person's unique situation.